This cancer treatment starts with your own cells. CAR T-cell therapy is a journey. Patients often think that it's a single infusion. However, there are a lot of preparation done before the infusion of the CAR T-cells. Okay, it involves 6 steps. The first step is assessment by a trained clinical hematologist. We go through the patient's details, the diagnosis, the extent of the diagnosis, the stage of the disease, what are the previous treatment received by the patient, and also the overall health condition of the patient and the current status of the disease as well. So all this assessment has to be done properly to evaluate whether the patient is an ideal candidate for CAR T-cell. Step 2 is to collect the T cells. This process is called apheresis, where the patient's white cells are collected and the T cells are separated and sent for the specialized lab. Next involves step 3, what we call as the manufacturing process. This is done outside the hospital in a very specialized lab. Depending on the type of cancer, the scientists will then use a very specialized virus or a vector to open up the patient's T cells and insert the CAR antigen, the specific antigen, into the patient's T cells. This is called the transduction process. Once this process has been done, this particular cell that has been genetically engineered will then allow to grow into millions of copies in the lab. After this has been done, we go to step 4, where preparation of the patient happens. And this is happening concurrently in the hospital, where we do bridging chemotherapy, hold the disease before the infusion of CAR cells. Once the infusion product is ready, we go to step 5, the infusion of the CAR cells. So at this point of time, patients are readmitted into the hospital, and just before the admission, patients are planned for a lymphodepletion chemotherapy, basically creating space in the marrow for the patient to receive the infusion CAR cells. After the lymphodepletion has occurred, next is infusion of the CAR cells. And this process happens on a single infusion, and it's done over a day. After which goes to step 6, which is the final stage, where after the infusion, patients are being monitored for any reaction. We are monitoring for any cytokine release syndrome or any neurotoxicity symptoms. If they are stable, they are then discharged and then followed up for long-term monitoring. This whole process from step 1 to step 6 can take several weeks. Patients are then monitored with regards to their disease response from the first month right up to month 3, month 6, and so forth. Because it's a living drug, therefore, we want to look at the expansion of the CAR cells and also to monitor the persistence of the CAR cells in the patients to have a constant killing of the cancer cells.